just a couple of days from now, India is going to kickstart the world's largest vaccination drive. If you're just tuning in, you're watching a very special episode on ET Now, Vaccine FAQ Answered. We are going to take on board your questions and queries, and I have with me a brilliant set of doctors to help you out with just that. Let me introduce them once again: Dr. Prateek Samdani, Dr. Mrinal Sarkar, as well as Dr. Arvinder Singh Soin. Gentlemen, I really appreciate you taking out time from all of your extremely busy schedules and joining us right here on ET Now to answer the questions, allay any fears, clarify any doubts that our viewers will have on a brand new vaccine that will now be entering the market, I guess, in just about 5 days from now. So, Dr. Soin, let me start off with you first. I think the key question that will be on everybody's mind, and I think I'll be answering quite a few questions really from our viewers when I just ask you this question, is safety and efficacy. So I'm going to be very blunt in asking you this, Dr. Soin. Based on your reading, how safe is it, how effective is it in protecting an individual from COVID-19?
So the vaccine that we are going to get in India first is the AstraZeneca Oxford vaccine. And it's been shown to be safe in a trial involving more than 25,000 patients. And it's been shown to be effective in generating an immune response against the virus antigens. And that efficacy, that effectiveness of generating an immune response is more than 95%. And in terms of efficacy, which means effectiveness against the virus itself, it's in the region of between 70 and 93%, depending on the dose schedule. That's the evidence of AstraZeneca vaccine so far that's available to us.
Okay, Okay, I think we've just snapped that line with Dr. Soin, but Dr. Samdani, let me take it across to you. You know, before that line got disconnected, Dr. Soin spoke about something called as efficacy. So if you could just break it down in simple terms, what does it mean when you say that a particular vaccine is XYZ%, has XYZ% efficacy? What exactly does it mean?
Thank you, Rubina. So, efficacy comes from the Latin word telling us, as the word suggests, effectiveness, or how good it is, how potent it is. So when we talk about a vaccine and we talk about efficacy, it means the percentage of people who will benefit from A, getting an infection, B, getting a severe infection. I think the vaccines that that India has undergone in terms of trials, they've proven their safety, tolerability, reactogenicity and immunogenicity. All of them have been proven by far, because we've had enough, more than 25,000 people. So I think the efficacy is certainly proven.
Okay. All right. Dr. Sarkar, so, we spoke about the two vaccines that are so far approved in India. Of course, the Prime Minister said that we are going to be seeing more vaccines come in the future. But for now, of course, we have Covishield and Covaxin by, Serum Institute and Bharat Biotech. So how would you sort of pitch the two? I mean, I'm not sure at this point of time what sort of a choice would we have in terms of, okay, whether I want to take Covishield or I want to take Covaxin. But if you had to sort of, based on the evidence and the data available, how would you sort of compare these two vaccines?
I think the evidence is out there. As far as the AstraZeneca vaccine, Oxford vaccine is concerned, the overall efficacy after 2 doses is something like 70%, although there's some preliminary data from UK saying that it may reach up to 80% after the second dose. As far as the other Covaxin in India, we do not yet have the complete data, at least in the public domain. They are from what I gather, they are targeting 25,000 in phase 3 trial, and of which more than 22,000 have already been recruited. So the approval most likely is come from the phase 1 and phase 2 trials, safety trials, etc., as well as immunogenicity, and some data which is not available in public domain. That's my guess. So once we have that data, we'll know how effective it is. But frankly, anything more than 50–60% also is good in breaking the chain of transmission. And more importantly, all the vaccines, not only the Indian vaccines, have been effective in reducing or eliminating need for hospitalization and to a large extent deaths from COVID. That is the biggest thing. One may get infection, one may get mild infection, which doesn't progress on to need for hospitalization or death. That is the biggest contribution of any vaccine. The third thing which we look at in terms of usefulness of vaccines would be whether somebody infected can then pass on the infection. The data for this is not yet available for most vaccines in the world, and I think only with time we'll get to know that. So as far as efficacy, little data which is available, I think both should be very, very good in terms of protection to people taking the vaccine. Of course, they need to take both the doses of the vaccine.
So the objective, of course, was to ensure that your life is saved. You know that even if you do get the infection, it's extremely mild. In fact, to achieve that, you really an efficacy of 50–60%, in fact, is sufficient. And most of these vaccines do have an efficacy of at least 75% and beyond. So the objective, the purpose, definitely has been saved. I think we have Dr. Soin back with us. Do we have him back with us? Okay, so Dr. Soin, objective achieved, but now the question is side effects. If I take a vaccine, I take the first dose, what kind of side effects could I expect, and what kind of side effects could I expect after the second dose?
So the common side effects of these vaccines that have been published and talked about by the manufacturers as well is a little bit of pain at the local site, some mild fever, body ache, and those are the only symptoms that happen to most of the patients who get it, and they may last for a day or so. So those are the simple side effects that happen with every vaccine injection, even in other diseases. Rarely you may get allergic reaction, which is called anaphylactoid or anaphylaxis reaction, in which the person may react strongly and the BP may fall. They may have respiratory difficulty. That's been seen in about a dozen patients so far in the Pfizer vaccine, and 3 or 4 patients that have been documented in the Astra vaccine, much less in the Astra vaccine than the Pfizer vaccine. So for that, you need to rest where you are for a while, maybe for half an hour. And if you're feeling giddy, then somebody needs to take your blood pressure. So, but for the most, it's just going to be some pain on the local site and some fatigue and fever, which goes away very quickly.
Right. Dr. Samdani, if you right now had to tell our viewers about simple do's and don'ts with respect to, the vaccination, what would you sort of encompass in that list for our viewers?
So first, I'd just like to tell the viewers that India has got one of the most robust immunization programs in the world. We manufacture 60% of the world's vaccines, and we inoculate more than 55 million people a year. So we've got a definitive, strong vaccination program, and the government of India is really behind this program since decades now. My do's for people are, especially if you fall in the first list of people, which are the healthcare workers and all the other people, as the Prime Minister just told us, you must come ahead and go and take this vaccine. Especially for the healthcare workers, one tagline is protect yourself because you will protect others then. So you must protect yourself. people who had high risks, maybe age more than 60 or 50, with comorbidities like diabetes, blood pressure, heart disease, some form of malignancy, liver issues, kidney issues, also need to be protected first. We know now that people above the age of 60 and 65 are more vulnerable to an infection and more susceptible to a severer infection. So these are the group of people who must come ahead and take the vaccine. Now, as we discuss about the side effects, Dr. Soin did mention something about anaphylaxis. So if you've had a past history of an anaphylaxis, my suggestion to the people are wait there for half an hour, 45 minutes after you take the shot, and then leave the vaccine room or the vaccine center. Do follow up for the second shot, because the second shot will give you the best immune response, or as we call medically as a secondary immune response, and that will give you great protection for however long, whether 6 months, 12 months, yet to be defined. So these two things are a must. If you do get some form of fever, pain at the site of injection, malaise, fatigue, headache, some form of cold, you have been vaccinated against a virus, so you will mimic symptoms of a viral infection. It'll last for no more than 24 and exceptionally more than 48 hours. So be fearless. I have one thing to tell our viewers today, that with the exception of clean and safe drinking water, there's no human endeavor rivals in immunization in combating infectious diseases, preventing infections, morbidity, and mortality. So vaccines, right from Edward Jenner in 1795 to the COVID vaccine in 2020-21 are here to stay. Please go ahead, don't be fearful, and join the program.
All right. Well, that's the word from Dr. Prateet Samdani. In fact, on that note, let me just round up all the COVID-19 vaccine myth-busters that may have been circulating. Some of you may have received some ludicrous WhatsApp forwards as well. I'd request you to not trust that. Trust only government sources. The first myth is that the vaccine will not give protection against the new strain of virus, and I will discuss that soon with our doctors as well. Well, the fact is currently there is no evidence that the vaccine will fail to protect against the new strain of virus, whether it's the UK virus or the Danish mink virus either. There's another myth. Only senior citizens, children below 10 and medical staff will get vaccinated. Well, you just heard out the Prime Minister that for now the government has identified certain high-risk groups. Of course, first are the brave hearts, the healthcare workers, the frontline workers. The second are the people over 50 years and person with comorbidity conditions, pardon me. Subsequently, vaccine will be provided to all others in need. There's another myth that there is no need to wear a vaccine or to take precautions after getting vaccinated. But here's a very important fact that I hope all our viewers follow. Even after you get vaccinated, you must wear a mask. You must follow all the COVID precautions, like even maintaining physical distancing after taking the vaccine. Another myth, taking the vaccine will alter the so-called RNA. Well, the COVID vaccine works with the help of the RNA. It does not have an impact on the DNA. And finally, the Indian vaccine is less effective as compared to other countries. Well, you heard out our doctors, you heard out the Prime Minister as well. It has undergone multiple tests, trials, and it is accurate and effective to fight COVID-19. On that note, we've got a couple of questions and queries lined up, most of them on our Twitter page. So let's take on board our very first Twitter query. We have Nafisa Petiwala writing in, asking for how long will the vaccine be effective, and the second is, will we have to take it at regular intervals? This is another very important question, and Dr. Sirkar, let me take your view on this. There have been certain rounds that this will perhaps become like a flu shot of sorts, that you have to take this a shot when on a seasonal basis the virus really gets the most activated. It's easily transmitted, and it's something that we usually see in the places like the United States. Do you think that the COVID-19 vaccine could sort of take a shape like that, Dr. Sirkar?
As of now, the data available suggests that the vaccination produces antibodies for at least 6 months. Only time will tell whether it lasts for a year or even 2 years. This virus is not going to go away. is going to be around, and it's very likely that we will need repeated vaccinations. Now, whether that will be yearly or it's good enough to do it 2 yearly, that time will tell. Also, these are the first generation vaccines. It's very likely that there would be further and even better vaccines available as time goes, maybe 1 year, 2 year, 3 year down the line. So things may change based on that. So as far as that is as far as your question is, of course, needless to say, till anything provides 100% coverage or nearly 100%, and the incidence of fresh infections in the world decreases to very small numbers, COVID appropriate behavior will remain the standard. That's not going to go away just because we are taking a vaccine.
Okay, so Dr. Sarkar, even after, this is something as well that I flagged off in our Mythbusters as well, but, just to ensure that it comes from a doctor, it's crucial that people still wear masks, still follow physical distancing, Dr. Sarkar?
Absolutely. Because nothing is providing 100% protection. What it is providing is even the claim the highest coverage of some of the vaccines available abroad is 90%, roughly 90%. So there would be 10% or more people who would still get infected. Perhaps the infection will be milder because of vaccination, but if you get infected, chances are you would also transmit it to others, maybe your family, maybe your colleagues at work. So protecting yourself with the vaccine along with masks and distancing is important, so that not only you don't get infected and nobody else gets infected from you.
All right. Okay, fair enough. Well, let's, take on board our next query. In fact, what I'm going to do is I'm going to take the liberty of clubbing our two questions that we've received together. One is, can a liver transplant patient take the vaccine? And the second one is, the peer review for Covaxin is yet to come out. So, is it worth taking a risk and vaccinating my senior citizen parents with it, or should we opt for Covishield? This is something that we discussed as well, that yes, we are waiting, the last trial phase for Covaxin, and hence perhaps, I guess this question really is, it's a very obvious question that people will ask. So essentially what we are dealing with is with category of patients. Who should take it? Who will it be safe for? Who should be a little wary of? So Dr. Soin, let me throw across this question to you. What's your view?
Inactivated vaccines are absolutely okay to take for liver transplant patients. I mean, I tell all my liver transplant patients to have the influenza vaccine, which is an inactivated vaccine. So it's absolutely safe. Having said that, the trial population so far for COVID vaccines has not included any transplant patients. So there is no direct evidence that it is okay, but evidence from other vaccines suggests that it would be all right for them to have the vaccination done in transplant patients. Now, the other question is in regards to whether Covaxin should be taken or Covishield should be taken. Well, the thing is that the evidence for efficacy of Covaxin will probably take another 2 or 3 months, because the phase 3 trials began in November. And efficacy, what does it mean? It means that a large section of the population has been exposed to the infection, and a certain percentage of them had the vaccine, and some people did not have the vaccine, and you then study the comparative incidence of infection among the vaccinated with those who did not have the vaccine, right? So that's what efficacy means. And that data for Covaxin will take another 2 months to come through. So given a choice, the first choice will be with Covishield, that's for sure. And that's what the government is also saying. But down the line, Covaxin will, I'm sure, will also prove useful. Having said that, the safety data for both is available. And like I said before, immunogenicity happens with both the vaccine. So, in terms of giving your elderly relatives the Covaxin, I don't think safety is going to be an issue. But efficacy data is still lacking.
Okay, all right. I hope that, our viewer is able to essentially benefit from the view that Dr. Soin has given. So he is saying, first choice, Dr. Soin is saying that currently his first choice is Covishield. And yes, as and when Bharat Biotech does have his do have their own trials conducted and there's more data available, then of course we'll know about Covaxin as well. Okay, let's now talk about mutations. I guess it's, from my limited knowledge around viruses, all viruses do, of course, naturally mutate over time. So obviously SARS-CoV-2 is no exception. This virus, of course, was identified now, more than a year ago. So I'm sure there have been plenty of mutations that have arisen. But I think for us, and a question that humanity needs to ask now, that can, the vaccine protect against all the potential mutations that this virus can take? So Dr. Samdani, what's your view?
Rubina, that's a great question, and there's so much of thought and fear in our viewers and the public. I must tell what mutation is. So mutation means a change in the genetic structure of a living organism. May it be a virus, a bacteria, a fungi, or anything. That means anything that's living can change its genetic structure. Now, here be it, we've had several mutations and we've had resistant strains to mutations also. Specifically related to the SARS-CoV-2, let me tell you a couple of mutations that we've already witnessed in decent or large numbers. So the first one was, if I remember, is the D614G. And they found this mutation in about 200 or 220 people. And when they studied this mutation, they found that the viral load increased, the infectivity increased, but there was no increase in severity. Then we came down to the mink, as you mentioned, Rubina, in the previous in the last 10 minutes, and this was also found in the Danish population. Again, there was no increase in severity of the infection. That's very, very important. Then we come to the UK variant. The UK variant is called the B.1.1.7. And this is the latest variant that we've recognized in September, October of 2020. This variant tells us that the rate of infection or infectivity is higher by 40 to 70%, but there is no increase or incidence of severity. So that should give us some great sigh of relief. And actually, let me tell you something about the UK variant. This variant was also seen in the South African population. And this was seen earlier, I think in July or August. And they also showed that there was an increased risk of transmissibility, not of severity. Now, let me tell you something that's a little medical jargon, but makes a lot of sense. When you give a person a vaccine, vaccines actually work on a body and induce what we call as a polyclonal antibody. That means multiple antibodies, and they also stimulate the T cell response. So T cells are a part of cells that help us fight infection and produce antibodies. When you get a polyclonal response, that's enhanced, the virus actually, this enhanced response actually recognizes several mutations. So my gut feeling is that this vaccine will work against all the mutations that we have witnessed till date. So I see no fear in taking the vaccine and no fear in fighting and combating this virus with this vaccine, even if it's mutated to whatever mutations we have today.
All right. So absolutely no fear in taking the vaccine. This is a very clear-cut view coming in from Dr. Prateek Samdani. In fact, Dr. Sarkar and Dr. Soin as well joined in on that opinion. But you know what? We'll take a very short break on the show. Let me remind all our viewers that you just have the last 15 odd minutes. Send in your questions. Use the hashtag AskETNow. Anything to do with the vaccine, any questions you may be having, tweet to us. We'll get it answered. Quick break on the show.